Hello and welcome. My name is Josh Cortez, a student physical therapy assistant at Big Al's Rehab Barn, and welcome to your HEP home exercise program. Here at Big Al's, we like to help our patients, caregivers, and patients' family educate themselves on how to properly work through their rehab programs using our different various tools. Let's get started. We have gone ahead and prepared a home exercise program for you using our video and teaching software. We will be walking you through your personalized home exercise program, teaching you how to record your vitals, how to do your home exercise programs, and also to keep you safe.
Thanks, Josh. Now, let's get started with some of our simple equipment with Garibaldi's workout. Some of the things that we're going to talk about today, Garibaldi, is how to measure your pulse ox or your O2 saturation. We'll also talk about how to read your heart rate reading and how to take your blood pressure. First, remove the blood pressure, the pulse ox oximeter from the pouch. Simply squeeze and place on your first finger like so and press the red button. When you see it light up, allow the machine to take its measurements. While we allow this machine to take our measurements, let's talk about the normals for your pulse ox and heart rate. So normal for pulse ox is going to be anything over 90. That's 90% oxygen saturation in your blood, and 160 to 100 beats per minute. So for me, and you can read this by pointing it down just like this and reading it at the face, is my resting heart rate is 63, between 60 and 100, and 99, between above 90. So that's good, that's normal. Next, let's talk about how to take our blood pressure. Take the provided blood pressure cuff that we provided in your exercise kit and place it on your arm. It'll tell you which side of your arm to place it on. Now, place your arm at the level of your heart and press the start button. Allow the machine to do its work. Remember to remain calm during this as the machine takes its vitals, because your heart rate and your level of your mood can alter the effects of the machine and the reading. So let's continue letting the machine take its reading. This can take up to a few minutes. It can be slightly uncomfortable. Great. What was your reading? Was it less than 120 over 80? If so, you did great. If all of your readings turned out normal and within these parameters, you're good to start exercise. So I'm going to turn you over to my friend and colleague, Juan.
Hi, I'm Juan. I'm going to help you get through your exercises here. We saved the best one for last. So, as my colleague Mitch taught you how to take your vitals, did you take your vitals already? Were they within those normal limits he stated? Good. All right, well, let's get started. With the green band provided in your exercise kit, we're going to walk over to the door. We're just going to wrap it around that door handle. We're going to start with your external rotations. So what you're going to do is start with your hand is going to be right in front of where your belly button is. Elbow's going to be tucked to your side, and you're just going to pull straight out just like this, nice and easy. Keep that shoulder back and relaxed and down. Don't let it creep up. And we're going to do 15 of these, okay? Good job. So now that we completed your first set, let's take your vitals. If you take your heart rate, is it above the 60 to 100? If so, good. Is your oxygen level still above 90? Good, let's proceed then. But before we do, these are some irregular readings that you should be mindful of. If your blood pressure goes up after you stop exercise, you should probably relax, take that blood pressure reading again, and then contact your provider if it doesn't go down after you stop exercise. If your heart rate doesn't go down after you stop exercise, you should also sit down, take a break, see if that heart rate goes down after you stop. If not, contact your medical provider. Now that we have that out of the way, let's get your other 2 sets done. All right. Good job. We completed those last 2 sets. Let's take your vitals one last time. All right. Now that you've completed your exercise and you're relaxing, has your pulse gone down or has it gone up or stayed the same? Remember, if it hasn't gone down, you should rest, relax a little bit, see if it goes down. If it doesn't go down, please contact your medical provider. Is your oxygen level still above 90? Good. If not, take some deep breaths, see if it goes up. If not, contact your medical provider. And your blood pressure, has it gone up? If you finish your exercise and it still is elevated, just relax, take your blood pressure again, and if it still hasn't gone down after exercise, please contact your medical provider.
Great job, Garibaldi. Nice work on those exercises. Creating a healthy habit is the first step to getting healthier and maintaining a healthy, more responsible way of living. And it can also help with all of your mental health issues.
Exercise has been proven to help lower depression. The more exercise you do, the better you're going to feel about yourself, the less pain you're going to have, and that's why we're here for you today. And here at Big Al's Rehab Center, we're here for you.
That's right. Me and Juan love working at Big Al's Rehab Barn because we can be here for you every step of the way. All right, keep up the good work and get those reps in, and remember, take those vitals. You can do it. Great job.